Dr. Vikki Petersen here. I heard from a reader today who asked a question that I think is very important, and it's definitely an area that I want to spend a little time addressing, and that is the area of negative celiac tests. So this woman has tried a gluten-free diet. She feels much better when she's off gluten, but she's been currently eating it, and she did a series of celiac tests, and they were all negative. And the question is, what does that mean? Does that mean I should go back to eating gluten? Was it just in my head that my thinking that it didn't suit me and I didn't really feel better when I was eating it? And it's just interesting the dilemma that comes up when a test does not support what you think is true. Now realize there's a difference between celiac disease and gluten sensitivity. With celiac disease, it's affecting 1% of the population. It's associated with a complete degradation, destruction of the villi or the lining of the small intestine. So that's one of the hallmark issues that occurs with celiac disease. With gluten sensitivity, you're still someone who does poorly with gluten. It can have very far-reaching effects, much as celiac does, but it doesn't have that hallmark trait of destroying the villi of the small intestine or the lining. It certainly can create gastrointestinal disturbances. It certainly can create what's called a leaky gut or a less than stable lining of the intestine. So it does many similar things. It's definitely deleterious to the health, but the celiac test will not be positive. The gene test for celiac will not be positive. But does that mean you're fine with gluten? Absolutely not. So what this particular woman should do, in my recommendation, is get tested for gluten sensitivity. Those are the immunoglobulin tests. There's the IgG and IgA for the antibody to gliadin, and that test would be very recommended. And even if that comes back negative, what we need to realize is that these tests do not have the sensitivity that they should have. And what that means is the result is a lot of false negatives, meaning that your immune system is reacting to gluten. You truly do feel better. That is accurate when you're not eating it, but the test is not exactly as sensitive as it needs to be, so we get these false negative results. So what I always say is the gold standard ultimately, if you've been tested for celiac and it's negative, even if you've been tested for gluten sensitivity and it's negative, if you take gluten completely out of your diet for 30 days and you notice an improvement in your health, that is the gold standard test. That does not lie. Asking your body how it feels and having your body improve in how it feels is a legitimate test, and please don't negate that, because at the moment that's one of the most sensitive tests we have, is literally changing our diet and having our body respond. So I hope that's helpful, and until next time, I wish you very good health.